Good evening, everyone, and a big warm welcome to you to the psychology program powered by SpringPod. Now, whether you've already started your program and your work or whether you're yet to start, we hope that you're enjoying it so far. Remember, if you have any questions, we are always happy to help, so just reach out to a member of our team. My name is Hope, and I am the representative from SpringPod today who will be hosting this session. And as you can see on our screen, we've got a wonderful guest who I'm going to introduce you to in a moment. First things first, let's go through a few housekeeping rules. So, this talk will last around 30 to 40 minutes today. It's your chance to ask the burning questions to someone who is working in the field that you're considering. So, please do make the most of that. You can get in touch by using the Q&A function that you can see on your screen. Now, if someone else asks a question that you think is a really great question, you also want to know the answer, then you can upvote it to the top of our list. You can do that by pressing the little thumbs up icon. And what that will mean is because we've only got a limited time today with our special guest, we'll be more than likely to answer those questions at the top. More than the ones at the bottom. Now, if you do miss a webinar or you need to leave halfway through, your mum's shouting you for your dinner, or you got to go put the bins out, whatever the case may be, we are recording this session and it will be available within 24 hours on the relevant module. So you can come back and you can watch it all over again. So, in this evening's webinar, we're going to be talking about health psychology. And joining us to do that, we have Anna Misztal, Assistant Psychologist at Croydon Talking Therapies. Anna, I'm sure I just battered your name. Please do correct me. What was it?
Yeah, it's okay. It's Misztal. So I come from Poland, hence why my accent as well. But yeah, it's all correct. So
Amazing. I'm really sorry that I got that
no
wrong.
worries.
It's lovely to have you here with us, Anna. Of course, you're going to answer all of our viewers' questions today. Fingers crossed, there are lots of them. But in the meantime, I think you've got a presentation to show us.
Yes, so I will share my screen just now. So please let me know if you can see my screen.
Yes, we can.
Perfect.
For those of
So
you at home, I recommend that you grab yourself a pen and paper to make some helpful notes. This should be a really great presentation. Anna, over to you.
perfect. Thank you, Hope, so much. Thank you for this beautiful introduction. My name is Anna. I'm an assistant psychologist, and today we'll talk about health psychology a little bit. When it comes to health psychology, it's a really broad area, so I'll try to explain it as clear as possible. Yes, I'll explain what health psychology is and what health psychologists do. So, I'm not a health psychologist, I'm an assistant psychologist, so I'm still in training, but I work in this field and I'm working towards my qualifications as well. So, I will explain why health psychology is really important, what are the most common issues that we address. I will also provide some examples from my role as an assistant psychologist, and I will explain how to become a health psychologist. So we'll start by explaining what health psychology is. And this is the study of psychological and behavioral processes, and that's really important to remember. Those psychological processes and behaviors can underlie health, illness, and healthcare. That's a definition provided by British Psychological Society. So when it comes to health, there might be psychological factors. So what I mean by that is the way we think, the way we feel can affect our health outcomes. So if our levels of stress, our immunity, for example, and developing diseases like it can be a flu, cold, or something more serious like cancer, diabetes. And behavioral factors are things that we do or we don't do. So how we react to the whole environment, how we react to stressful situations, for example. And there's also cultural factors, so the whole environment that we live in, and also a set of beliefs that we acquired through this environment, so like values, traditions, and so on. Health psychologists understand health to be the product and not only of biological processes, but also psychological, behavioral, and social processes. And we use this model, so that's the biopsychosocial model of health, to understand people's behavior and health. This model was developed in 1977 by psychiatrists, and that was an alternative to biomedical model that only focuses on purely health processes, so purely biology. So there is like an infection, and infection leads to a disease. So in this model, we have three different components. So there's also biology, so our genetics, disease, gender, age, so things like that. There is psychology, so our beliefs, our self-esteem, emotions, and coping and behavior, so how we respond to different situations. So those coping strategies can be learned, or that can be something also related to biology. That's why it's connected. And also social context, so our support network, so our friends, family members who may support us or may not support us as well, family background, cultural traditions, and education. So this model helps to understand subjective view of our clients, so subjective view of illness and suffering. So those three different things can impact how we cope with illness. So that can be any kind of illness, physical health illness. So the biopsychosocial model views health and illness behaviors are products of those things as well. And this model can be helpful in developing treatments for people with, for example, weight problems or smoking problems, alcohol problems, and medical treatments as well. And it helps with developing research that focuses on prevention and intervention programs designed to promote healthier lifestyles like exercise, nutrition, and also other things related to it. And why it's important? So health psychologists, they focus on the health of their clients to improve their health through different interventions. So not only psychological interventions, but also something like diet, exercise, so helping clients to engage in those interventions. Health psychologists also examine the link between person's psychological health, so how the psychology can impact their physical health, and they can work in different services. So that can be pain management, oncology, primary care. Health psychologists also work in government and social services organizations, because they can, through their practice and through their research, they can inform policy changes. So how we can make sure that our society is functioning as best as we can. So how to improve people's health so they can enjoy their life and they can live their life to the fullest. So and also another thing is research. So it's a huge part in health psychology, or even if you study psychology in general, so that's a science. So we do research in order to identify different kind of components of people behavior. So that can be mental health and physical health. Health psychology is like a very holistic field, so we focus on both things. And also research can influence the effectiveness of healthcare. So health psychologists can help other professionals like doctors, nurses, and other team members to improve the delivery of healthcare services. So why health psychology is important? In England, there's 30% of people live with at least one long-term physical health condition. And when it comes to those conditions, there are conditions for which there is currently no cure. And these conditions can be managed by medication or other treatments only. So it could be cancer, it could be diabetes, heart problems, arthritis. Also, it can be long COVID. So I'll discuss that later as well. And out of those 30% of people with long-term conditions, we've got also 30% of people with mental health problems. So there is a huge link between physical health and mental health. So we don't know what comes first. It's just association between those things. So people with very difficult conditions that impact their day-to-day life, so they are unable to work or socialize, they may develop anxiety or depression. That's 5 million people with long-term conditions. Okay. Here are some examples of common issues that we address. So it can be stress reduction. So how to support people to reduce their stress so they can enjoy their life much more. Weight management to address the pandemic of obesity, pain management as well. That's another huge field in health psychology. When it comes to pain, it's a really subjective thing as well, and that can be related to psychological processes. So people with anxiety, for example, they may tense their body more than other people, and they can develop back pain, and maybe their posture can also differ in some way. Smoking cessation, that's an important topic. Illness prevention, I think I haven't mentioned that yet. So how we can prevent illness in our society, in our population, how we can support people to live much healthier lives. Managing chronic conditions, so that can be adherence to treatment, adherence to medication. Many people are not adherent, so we need to, so health psychologists look at how we can improve this. And there's more. So anything related to physical health can be so any kind of physical health condition can be addressed by health psychologists if there is also a mental health component to this. So yes, I said more because long COVID is another example. So that's a new thing. Also, it's called post-COVID syndrome. So how we define this? So when it comes to COVID, people may have different symptoms. So all of those symptoms here. So fatigue, brain fog, shortness of breath, persistent cough, broken sleep, chest pain, loss of smell. However, if those symptoms last longer than 12 weeks, then it's called long COVID. And if there's nothing else going on, if there's no underlying condition, then we would call it long COVID. Um, so also, it has been found by the University of Oxford that 15% of people who had COVID-19, they also developed depression or anxiety. So as health psychologists, we can address that. We can develop interventions. Um, and this is one example from my current job as an assistant psychologist. So I work with people with common mental health difficulties like anxiety, depression, and phobias. But we also observe that there's a lot of people coming to our service that have physical health symptoms. So there is a long-term COVID project, long-term conditions project, and we developed a long COVID group for those clients who are struggling with symptoms of long COVID. So this kind of intervention was based on what we know that works in mental health problems. So we used the cognitive behavioral therapy model to develop this intervention. So in those groups, we discussed the impact of long COVID on people's lives. We also incorporated some behavior activation techniques. What it means is so if people with long COVID have chronic pain, like back pain, or if they have extreme fatigue, how to help them to enjoy their life. So one example can be pacing, so doing things very slowly or planning things. Sleep hygiene, so many people also with long COVID reported sleep difficulties. So we also adjusted this treatment to their needs. Worry management, so some people may worry about being reinfected or worry about how to manage their lives. So that's another component of this group. There's also other things that we included, but it's a long list. So my role as an assistant psychologist was to assess people and they condition their symptoms and also screen for potential participants for this group. I also do reviews with those clients and follow up. So it's really interesting role. There is a variety of different tasks that I do, and so I learn every day. I think the when it comes to studying psychology, I learn theory, but in in my current role, I use this theory in practice, and I can understand better how everything works. And yes, and after this group, I will also investigate the effectiveness of this intervention. So it's like a research component of this role, and everything that I'm doing is under the supervision of senior practitioners. So as an assistant psychologist, I'm not a registered health psychologist, so we need the supervision. But even if you're a registered psychologist or registered clinician, there's always someone to supervise you. So yeah, you're not left alone. So now you may ask how to become a health psychologist. So maybe you got really interested in this field. That's the way to get there. So you need to have an undergraduate degree in psychology that is accredited by the British Psychological Society, and that's really, really, really important. So I cannot stress that enough. If you're looking for applying to those courses, please make sure it's BPS accredited. So that's the first step, and after the step, you can do a postgraduate degree in health psychology. So that's master's stage 1. If you want to do a different field of psychology, like forensic psychology, that it would look similar, but it would be a different discipline. And then to become a registered psychologist, to be like a registered professional, you need a doctorate in health psychology. There is a number of ways to do it. And during this training, so I found training in health psychology really, really fascinating. So during master's degree, I did a lot of research. We also did a lot of teamwork. So that was really interesting. But to become a health psychologist during doctoral phase of this pathway, you need to also present those skills in here. So professional skills like teamwork. You need to also prove that you can deliver and evaluate psychological interventions, research skills. So designing research studies, consultancy, and teaching and training. So that's what I'm about to do. Some of those skills you can learn in stage 1, so during masters, but also during your doctoral level studies, you have to prove that you can practice those skills in a healthcare setting. So yes, and I think that's all. So these are helpful resources if you want to know more about health psychology. I would recommend going to the British Psychological Society careers website. So there are different um, types of psychology, so like forensic, clinical. So you can go and check what requirements you need to have to get their health careers as well. So that's a really helpful website to explore those roles. Journal of Health Psychology. So if you're interested in research, if you want to see what are the current topics explored, you can go to this website as well. And IAP pathway for people with long-term conditions. So that's primary care pathway. So how those conditions are treated in primary care. And then yes, and so thank you for taking your time to listen to me. I hope everything makes sense. I'll be happy now to answer any of your questions. So over to you, Hope. I'm gonna unshare my screen.
Anna, thank you so much for that. Really insightful stuff, and really helpful that you showed the arrows of how you go about getting qualified, because a lot of the time students aren't always aware of the simplest or the essential, I should say, route. Touching on that, someone has asked, what are the usual GCSE or A levels people should go for? What would you recommend?
When it comes to health psychology, oh, not health psychology, but general psychology, it can be any GCSE. I think some of those courses they prefer people having maths or biology, chemistry, because it really depends. If you do Bachelor of Science, which I did, you need to have some skills to understand statistics, for example, but it's not too advanced. So I
Mhm.
would recommend math, biology. There's not too much biology when it comes to psychology. There is some. So that's why it's really important. And maybe chemistry. So any science and maths. And it can be also English or anything else because, yeah. it really depends on the course. So I would recommend going to those websites.
Yeah, and also I think a maths and a science will be helpful for a lot of different fields. So when it comes to choosing
Exactly.
your topics, they are good ones to go for to open some doors up. Also on the topic of universities, Anna, are there any particular universities you would recommend?
So I would always recommend King's College London. That's the
Mhm.
one I studied in. The reason is they have the oldest clinical psychology doctorate program as well in the country, and they have a lot of resources. So that's the one, yeah, that I experienced. So I had really good experience there. So I would always recommend King's. But apart from this, when it comes to health psychology, I would recommend University of Surrey because they have a huge health psychology department. So yes, I think those two, and also I think UCL. That's another one.
Cool. Okay. And talking about, we've spoken about kind of qualifications and the skills required. What about work experience? Is that something that people will be able to do? And if they can do work experience, how would you recommend they get that?
Yes. So when it comes to psychology, it's really competitive, but also there is plenty of voluntary positions. So I would check Mind Charity, which is the biggest charity for mental health, because they always need some volunteers to help them
Yeah.
with all the everything. It doesn't have to be direct contact with clients, but also understanding the whole kind of the backstage of everything. So how things are run, how the healthcare system works. It would help to see. So Mind Charity, and yeah. Maybe other mental health charities, but that's the one I'm aware of.
Yeah, I'm assuming that because mental health is such a focus point nowadays, and rightly so, there would be a lot of kind of local charities in different areas. So it might be worth just doing a Google search and finding something.
Yes, definitely. Also, any homeless shelters, so
Mhm.
anything like this, because there's, yeah. Also, primary care services, maybe if they require some volunteers. So going on the NHS website as well, if there's anything in your local area, because any mental health service needs more volunteers. It's really, um, we're really short-staffed when it comes to this.
Yeah, I can imagine. Another question then. I mean, I know that you kind of said that it's a very busy day for you, but someone has asked, what is a day in the life like for a health psychologist?
I'm not sure about health psychologist. I know about assistant psychologist. So it really depends on the service. Some services can be busier than others. Like primary care services can be really busy. Secondary, yeah, all the services actually. Um, so in my role now, I'm doing assessments and treatment. So there's a lot of face-to-face contact. So it can be, I can see a number of clients. So for example, 4 clients per hour. It really depends, and also reviews. So it's a busy day. It can be flexible depending on your role. If you do assessment, there might be strict hours, so it can be fixed hours throughout the day. But in my role, 90 or 80% of what I do is clinical. So speaking with clients, there's also a huge admin component. So writing reports, letters. Um, so that's something that I spend less time on because there is a lot of face-to-face and contact, creating groups, as I mentioned. So developing groups materials some of those days, but really every day is different. Um, so yeah, I'm not sure if I'm explaining that
No,
right, but
you absolutely are. I mean, I think, I mean, everyone's different, but I think roles there where there's variety and there's room to chat to different people and do different things keeps it exciting, doesn't it?
yes, definitely. Definitely. Also, in psychology, you spend a lot of time reading about the newest research,
Mhm.
also upgrading your knowledge because there's always some new information about conditions. There's also new discovery, so it's really exciting topic to study because it's not like there's no point that you would just finish, like
Yeah,
you know
you're
everything,
learning and growing,
because yeah,
evolving.
yeah, you need to evolve, you need to grow, and in any role that you do in health psychology, you will learn so much.
Mhm.
So, if you're thinking about getting experience, please do not focus only on face-to-face contact with clients. It can be also working with other health professionals that you can learn from. So, yeah, that's it. Yeah, that's all exciting.
Well, on that motivational note, that is the end of the questions. It's been a wonderful presentation, Anna. Thank you so much for your time. It's been wonderful hearing more about what you do in psychology as a whole. So thank you. Um,
Thank you. I hope so much.
Yeah, you're welcome. Quick reminder to those at home. Firstly, thank you for all of your questions. They were fantastic, and hopefully, you'll be well on your way into being inspired into studying psychology. A reminder that you need to get your work submitted by the 25th, I believe. Yep, 25th of Feb in order to receive your certificate. So don't forget to do that. If you need a reminder of any key dates, you can refer to Module 1, and they are all listed there for you. Once again, thank you very much. Good luck with the program. And Anna, lovely to meet you. Have a wonderful evening.
Lovely to meet you as well. Bye bye.
Bye.